Being a silent killer in the world, people need to be sensitized about screening. So people need to have free services of cancer screening so that many women are touched. Those ones in deep areas like here where we are now. If we hadn't brought this free cancer screening, people would be there ignorant. They don't know what is cancer. So we have tried to counsel them. We talked about it in all ways, and they understood it.
Okay, nyowenka mbabazi cyo venta nyo nashemererwa munonga kugira ngo twafuna abashaho bahihi kandi bambakeberera busha iki nayegamu nyo nayegamu ngo obwiro bwinjimere nikira kushasho munda nangu turani mangu nyine kansa hati nanimbasa kugumira untinde kinkumanya konga kuniza abashaho banshobora bancebera nyo nahure iki kintu nakikunda mbene nyihanangiriza abagenzi banje abatija bagezeho bahike hina abashaho nabo abantu abinjine batina ngo bambakebera kansa ya nyinenda nibihayo nyinenda uba bakiteka hansi konke cyo tukwe kiri
gunasomamu ebintu bibiri ko kucebeza kare waye manyango yine kansa ya nyinenda bakuragurira kare okera wabo takaji oburire butakakire stage ya muheru kuyamba munonga ubutiha mu nyinenda yawe.
Pre-cervical cancer screening is important to Ugandans because most of them are needy, are vulnerable. They cannot afford they cannot afford the checkups for cervical cancer. So that's why I think it's important, because most of the women really need these services, but they cannot extend it to themselves.
My name is Kuchirza Abad, and on behalf of leaders of Ukanga Chienje, we are so grateful to having received Touching Lives initiative in our area to bring us this service for the first time. It's very, very important, and we really appreciate, and we are very, very, very thankful and very grateful. Many mothers around this area did not know what cervical cancer is. Now they have got enough training. They can come for screening anytime without fear. In their speech, you saw some were saying they had never received this and they didn't know what it was about. So we ask Touching Lives Initiative and your partners like Mary Stops, Blood Bank, to come again and enlighten more or educate more our mothers so that cervical cancer is no longer a problem in our area. We thank you very much.
Much as we've tried to always extend these services to the vulnerable mothers who cannot afford them, these are the challenges that we've faced. We call upon the Ministry of Health to come and give us some support so that we can keep on extending these free medical services to the vulnerable mothers. For example, like the cervical cancer screening, which we always take to the vulnerable mothers in rural areas, and most of them are really surprised. They don't know how they test cancer, cervical cancer, they don't know how they screen cervical cancer, and most of them are also overwhelmed when we extend these services to those vulnerable women. So I call upon again the Ministry of Health to give us enough support so that we can move around the whole country extending these free medical services to the mothers.